In a world overrun with the fake, delusional, and disingenuous, he stands as a beacon of truth. He is Abuki Cabal. You are listening to Abuki Cabal.
Welcome to the Abuki Cabal Show.
What's going on, everybody? Welcome to the show. If you're new to the show, please like, share, and subscribe. If you are a return guest, then welcome to the show, and hope you enjoy the content. And please like, share, and subscribe. Also hit that notification button. It helps me out with the algorithm, and I appreciate that. Also, check in time to time and make sure that the notification button is working, because I'm getting some feedback on that, saying that some people are not being notified. So today, one of my resident haters in the group has requested that I cover some of the complications with the vaccine, and I accept. So I'm going to discuss today the rare instances of complications linked to the circulating spike protein associated with the COVID immunizations. Okay, so I'm going to touch on a couple of different articles, and the second one is basically the directive from the CDC about the study and their recommendations. So we'll start out with it, and like I said, the title is of a couple of the articles that have been presented, even this one in the European Journal of Clinical Investigation. The rare COVID-19 vaccine complication linked to circulating spike protein in blood. And the other one states, circulating spike protein detected in post-COVID-19 messenger RNA vaccine, myocarditis. Okay. The European study says COVID-19 vaccine induced myocarditis in young males, a systematic review, and that was done last year in December the 28th, to be exact. Okay, let's go up here and take a look at it. All right, here's the first one, and we'll go ahead and get into that.
Rare COVID-19 vaccine complication linked to circulating spike protein in blood. Young adults and adolescents that suffered from rare cases of myocarditis following vaccination with a mRNA-based COVID-19 vaccine had increased levels of the viral protein spike in their bloodstream, found a recent study carried out by a team at Brigham and Women's Hospital and Massachusetts General Hospital. However, it also concluded that the benefits of COVID-19 vaccination still greatly outweigh the risks. Myocarditis occurs when heart muscle tissue becomes inflamed, often resulting in chest pain and fatigue. It is observed in a number of conditions including viral infections and inflammatory diseases. In extremely rare cases, roughly 1 or 2 people per 100,000, myocarditis can result from vaccination by an mRNA COVID-19 vaccine such as those developed by Pfizer and Moderna. The reason why mRNA vaccines occasionally trigger myocarditis remains unclear, and unraveling the mystery could lead to more effective treatments for these rare cases. In the study, published in the journal Circulation, the research team recruited 61 adolescents and young adults. 15 that developed myocarditis after being given the Pfizer BNT162b2 or Moderna mRNA-1273 COVID-19 mRNA vaccines, and 45 healthy, vaccinated and age-matched volunteers. The researchers then screened blood samples from the participants to profile their immune system, including testing for autoantibodies and antibodies against human viruses, analyzing T cells and measuring blood levels of cytokines and SARS-CoV-2 antigens such as the spike protein. The research team discovered that the myocarditis patients had indistinguishable antibody responses and T cell responses to those of the controls, such as antibody production, autoantibodies and T cell profiles. However, they found that the myocarditis patients had elevated levels of the spike protein in their blood, which had seemingly evaded the immune response. In contrast, the healthy controls showed no detectable levels of spike protein in their blood. Additionally, the myocarditis patients had higher blood levels of cytokines, an indicator of innate inflammation, and troponin, a sign of injury to the heart. The risk of developing severe disease from acute infection significantly outweighs this rare risk, stated Lael Juncker, pediatric pulmonary medicine specialist at Mass General for Children, and first author of the study. While this finding helps us better understand this potential complication, it does not alter the risk-benefit ratio of receiving the COVID vaccines. The incidence of myocarditis and other heart-related complications among children infected with SARS-CoV-2 is much higher than the risk of post-vaccination myocarditis.
Okay, so as you can see with the first parts of the article, for those who are still detractors and feel like that people have been lying about the COVID-19 vaccines and their effectiveness, there is some risk, and they are studying that risk. They've been studying that risk ever since 2021. So the information was out there, but like all medical information, scientific information, as that information comes in, things change. So nothing has changed as far as the risk to benefit ratio for the treatment with regard to immunizations and preventative measures for getting COVID-19. Okay, so excuse me. So I don't know, what the argument is. I mean, there is no proof behind any of the claims of these individuals about people just dying in mass after being injected with COVID-19. I mean, these instances are like a small percentage of the people that have been immunized with this, with the immunizations. So I think it's like 5 instances out of every 100,000. So if you scale that up, then it's point something percentages. So that's not even it's there, but it's not a huge number. Okay. So, and these are found in people who are younger, who we're going to find out in this article that have certain things that are unique to them that we see the spike protein in. It talks about the troponin levels. We do those. We draw troponin levels in heart attack victims. So there is a way to detect, whether there is some indications of heart inflammation. So again, there's a lot of information in this that indicates that yes, they are staying on top of the problem and they are monitoring the problem, but it is not a huge issue. And again, it says over and over again, the risk to benefit ratio has not changed. So let's move on.
The authors also noted it remains unclear whether the circulating spike protein was the cause of the myocarditis observed in these patients. Rare cases of myocarditis can occur after receiving vaccines for other conditions such as smallpox. So the spike protein could have been a biomarker of underlying immune dysregulation leading to the symptoms. This was a precious sample set because these cases are so rare, stated co-corresponding author David Walt, professor in the Brigham's Department of Pathology. We studied them in great depth, which led to an interesting finding that could guide treatment strategies to reverse post-vaccine myocarditis. Previously suggested causes for post-vaccine myocarditis include aberrant immune responses to the vaccine, the production of autoantibodies, or potentially spike protein mimicking self-antigens, leading the immune system to attack heart tissue. Another factor at play is that myocarditis affects young men more than young women, which could be explained with hormonal mechanisms. Nonetheless, Yonker and Walt et al. Found circulating spike protein in female patients as much as in male patients. The authors acknowledged limitations in their study, with a myocarditis group sample size of just 16. However, given the rarity of these cases, it was to be expected. In any case, the study continues to hammer home the point that vaccination for COVID-19 carries much fewer risks than infection by the virus, including for adolescents and young adults. In most cases, post-vaccination myocarditis is mild and self-resolving, said Yonker. But new insights about its cause could further help us to improve patients' symptoms or prevent this complication from occurring.
Okay, so there you have it. Okay, so I looked up the instances of myocarditis that happen without any kind of immunizations that just happen and we don't even know why it happens. Okay, so during a 1-year study period, 2,861 people, or 0.007% of people were hospitalized or died from myocarditis. Okay, so there are instances of myocarditis in the population already. So, with that being said, we'll move on to the other one. Before we do that, I'm going to touch on touch on another aspect of this, which we need to cover because we're seeing a huge amount of this when we're talking about things like these immunizations and any kind of medical intervention. Okay, so and that is this right here. You have a number of especially black folks that are running around, acting superstitious and, just acting like folks used to describe us. We were easily frightened. We were, we're superstitious. We were easily motivated by fear. Okay. Used to say that when the Klan used to come, and all they had to do was just dress up like some spooks and basically, we would basically be easily managed. Okay. So we're starting to see a lot of that also with a lot of people who, have read about Tuskegee and whatnot and think they know what happened and what they're reading. Okay. A lot of people read that, but they really don't understand how a study is conducted, what's done, what's not done, whether these people were actually infected with a pathogen and then studied, or whether they had the pathogen in the first place. Okay. So, that type of phobia, is covered by a couple of different diagnoses. And these are psychological diagnoses that are made. Medication phobia, also known as pharmacophobia, is a fear of the use of pharmacological treatments. In severe, excessive, and irrational cases, it may be a type of specific phobia, like a lot of people who have read information that has led them to believe that, the medical field can't be trusted. People who are nurses and doctors can't be trusted. This basically happened under, the presidency of Trump because lies have become so, we've been inundated by lies and false information to the point where, people are starting to just believe it. And this is the result. Nobody trusts anything. Nobody trusts the government. Nobody trusts hospitals. Nobody trusts anything or anybody. So it's affecting us in a lot of ways. The other diagnosis is called iatrophobia, and it is an abnormal or irrational fear of doctors or going to the doctor, and it's synonymous with medicophobia or iatromesia. Okay, and then you have the other aspect, which we're inundated with all of this information, and some people can take this information and basically break it down into bite-sized chunks that they can deal with and can absorb, whereas other people have never been taught how to deal with this type of information, like studies and whatnot. I mean, they could be reading these studies and still not even know what these studies are saying. People don't know how to research. People don't know how to look at reputable sources or not. Then you just have some people who are just, they're these bohemian types that everything is roots and herbs, and all of this homeopathic approaches to everything. And I respect some treatments that are homeopathic, but there is a lot of information out there that says that a lot of these homeopathic approaches are ineffective. They're basically just a placebo, and that you're taking, and you say you feel better, you think you look better, and the mind can make you see and believe a lot of different things. Okay. So, that specific phenomenon is called analysis paralysis, or paralysis by analysis. Okay. And it describes an individual or group process when overanalyzing or overthinking a situation can cause forward motion or decision making to become paralyzed, meaning that no solution or course of action is decided upon. Okay. We see this when we discuss certain topics with the ladies. They refuse to accept information. I just had a conversation with my sister earlier, and we were talking about she just could not acknowledge that there is a problem with a lot of women in our community, and immediately it was, well, I could say the same thing about men. And I had to break it down to her. Okay, if we're talking about tornadoes, and then you say, well, I could say the same thing about clowns. Well, we're not talking about clowns. We're talking about tornadoes. And then she started, saying that I was getting emotional because I'm stating what I see and what I have read. And she says, well, but you don't have to take it personally, and you can choose to not deal with these people. It was all kinds of excuses and advice, but she never could acknowledge that there are some significant problems with the ladies in our community. With the attitudes and the approach to interacting with professional folks, with on the job, personal interaction, all manner of personal interaction is just adversarial. So we also see this, with a lot of the guys. The guys, since they've been raised by these single mothers and other types, that they just can't break away from their program. They immediately rush to the defense of the dysfunction. And here with this medical situation, I mean, we have people who are out here, professing to be authorities on treatments and science that they don't even have any basis for. They're out just having an opinion on something that they don't have any data on. The science isn't consistent with anything that they're saying, but they're spreading this stuff around because they have a means by which to do it. I.e., folks out here taking ivermectin. And I mean, clearly the science showed that was just not a treatment. But because Joe Rogan and a bunch of other scientists, who were basically, Trumpers, basically came out, and Fox Newsers, came out and said to do it, and you have all these black folks who support Trump and support, disavowing, this system of white supremacy or whatever the case may be. Then they basically take that approach, but, like I said, inconvenient truths are truths nonetheless. You can run around and act like the truth isn't the truth, but it's going to catch you and you're going to have to deal with it, and if you can't handle the information, then allow other people to disseminate that information to you, in ways that you can understand. Don't paralyze yourself, with something, that is too much for you. Have enough sense to know that you don't know. Okay. I just did a code on a lady last night. I worked on her for a long time and died. COVID. Okay. So I see it. I see it up close. I work on people. Try to keep them alive, through the whole process. Some make it, some don't. So when people start to tell me things about, what they think about COVID, it's totally different than what I see and what I know about COVID. And I'm selective about how much I say about it, as well as other people. But this is a problem, and they're not reporting the numbers, but the numbers are up. We have more cases now than we had in the first round. 200 million cases in the United States. Okay. In China, they're underreporting their cases, but a lot of the information that's coming out of China right now is indicating that they are having massive problems, to the tune of thousands of people who are infected that they're trying to isolate, and those people are getting out because they don't want to be quarantined because they're watching things over here and they're rebelling against quarantining in place. And we're starting to see the same effect. These thousands of people who get out in the general public are spreading it to the tune of today, last time I looked at it, to where 90% of the population is infected. Okay. So that is disastrous because that gives the disease ample opportunity to mutate and become stronger and spread around the world and do worse. Okay. And that's all because of, misinformation and fear mongering from people. So let's go back up and let's look at the other information. Okay, here's the actual study itself, where it talks about every aspect of the study. And if you want to go through that, I'm not going to go through that for the sake of time. As you can see, it deals with every aspect of the study. Now, I'll go down to the conclusion and just discuss that. Okay, the conclusion says myocarditis is a serious adverse event that disproportionately affects men under 40, with the highest risk among men aged 12 to 24 who received a second dose of the COVID-19 mRNA vaccine. We show that when investigators present the risk of myocarditis stratified by sex, age, dose, number, and manufacturer, it is much larger than without stratification. An important safety signal may have been ignored or minimized by the failure to stratify appropriately. Now, some people might not even understand what that means. Stratification means broke up by specific things in the people that you study. Age, sex, all that it just said before. Number of doses, whether you have other things that they're looking for that might be detrimental to the study or might be indicative of some other aspect of what they're studying about being immunized, whatever it is. It's in the study what that stratification needed to be. So if you want to read that and you want to get deep into this information, it'll be here for you. Okay. But everybody's being transparent, that the information is here. Nobody's, acting like there are no risks to the immunizations. But as you heard, there are immunization risks for smallpox, for the flu vaccine, for any vaccine. You could have a reaction to it, and we have things where we can address that. When you get these vaccines, you have to sit and you have to wait for a little while after the vaccine to make sure that you don't have a reaction to it. And we monitor you, and we have medication on hand to where if you have a reaction to it, that we can treat you and immediately nullify the majority of the symptoms associated with you having an allergic reaction to the vaccine. So let's move on to the other article, which is the CDC directives on the vaccine and immunizations. Okay, it says clinical considerations for myocarditis and pericarditis after receipt of the mRNA COVID-19 vaccines among adolescents and young children. Okay, in summary, in April 2021, increased cases of myocarditis and pericarditis were reported in the United States after the mRNA COVID-19 vaccination, Pfizer, BioNTech, and Moderna. Data from multiple studies show a rare risk of myocarditis and or pericarditis following receipt of the mRNA COVID-19 vaccines. These rare cases of myocarditis and pericarditis have occurred most frequently in adolescents and young adult males ages 16 years and older within 7 days after receiving the second dose of the mRNA COVID-19 vaccine, Pfizer, BioNTech, and Moderna. There has not been a similar reporting pattern observed after receipt of the Hansen COVID-19 vaccine from Johnson & Johnson. Okay? The CDC continues to recommend COVID-19 vaccinations for everyone 6 months of age and older. The Advisory Committee on Immunizations Practices, ACIP, and the CDC have determined that the benefits such as prevention of COVID-19 cases and its severe outcomes outweigh the risk of myocarditis and pericarditis after receipt of a mRNA COVID-19 vaccine. Okay, so again, recommendations for clinicians. Okay, we'll go through the background. Myocarditis is inflammation of the heart muscle, and pericarditis is inflammation of the lining outside of the heart. In both cases, the body's immune system is causing inflammation in response to an infection or some other trigger. CDC has published case definitions for myocarditis and pericarditis. Okay, and it has a link for that. Okay, the severity of cases of myocarditis and pericarditis can vary. For most cases of myocarditis and pericarditis, following vaccination with mRNA COVID-19 vaccines, patients who presented for medical care have responded well to medications and rest and had prompt improvement of symptoms. CDC is assessing long-term outcomes of myocarditis after mRNA COVID-19 vaccines. Preliminary data from surveys conducted at least 90 days after the myocarditis diagnosis showed most patients were fully recovered from their myocarditis. Recommendations for clinicians: report all cases of myocarditis and pericarditis post-COVID-19 vaccinations to the VAERS system. Okay, and that's where all of the information goes for any adverse reaction to immunizations. Okay, consider myocarditis and pericarditis in persons with acute chest pain, shortness of breath, or palpitations, particularly in adolescents and young adults. Younger children who have myocarditis or pericarditis may have nonspecific symptoms such as irritability, vomiting, poor feeding, tachypnea, and lethargy. Okay? So, another thing I need to say too is that, the COVID itself can cause some of the same issues to be seen. Case in point, if you have a person who has respiratory issues, asthma, COPD, who may have, had multiple infections, say cold, flu, and COVID, the coughing, and whatnot, can throw you off even after, say, they've gone through the time period that we work on trying to get them asymptomatic and getting over the COVID infection. Things can still happen outside of that window. You will still pop on the test after that because you have COVID antibodies in your system. So there's a time period where you shouldn't be tested because you're still going to pop on the test even though you don't have COVID or you're not infectious. Okay. So, say you have a respiratory situation like that and you're being treated for that, and you're treating for the cough, you're watching out for fevers and whatnot, and the person looks like they're okay. The risk for throwing a clot are still there. That's the cytokine response that can happen in long COVID or during a COVID infection or post-COVID infection after a certain amount of time. Okay? I've seen people who have gotten over COVID and who are basically outside of it. You're still treating them, but they're over the initial infection and they die. Okay? So it can happen. They can die when they have the COVID infection and are trying to get over it, or they can die afterward from some complications from the infection. Clots in your brain, your heart, your lungs, anywhere, because of the response that your body has. It's a massive inflammatory response that can happen without warning. Okay? So you can risk that, or you can get vaccinated. I can't tell you what to do. There are treatments out here and there are immunizations out here that you can take advantage of. If you don't want to take advantage of them, you do what you want to do. Because we're no longer in the business of trying to force anybody to be immunized. Never, nor will we ever in the business of forcing people. It was in the interest of public good that everyone that they could get immunized would be immunized. But we have a perfect experiment going on right now in China where you can see where the majority of the people are infected. Even the young folks are going out and purposely getting infected because they think that will allow them to continue to be able to move freely throughout the country, and they'll just get it and get over it. Well, the flip side of it is a lot of people are going to die. You're not going to know who's going to die. It's like rolling the dice, but a lot of people are going to die. So I'll get into that a little bit more with some of the other information that I have from over there. So where was I? Okay. Ask about prior COVID-19 vaccination if you identify these symptoms as well as relevant other medical, travel, and social history. Okay? These are the things that we have to do. For initial evaluation, consider the EKG, troponin level, and inflammatory markers such as C-reactive protein and erythrocyte sedimentation rate. Okay? In the settings of normal EKG and troponin and inflammatory markers, myocarditis or pericarditis are unlikely. For suspected cases, consider consultation with a cardiologist for assistance with cardiac evaluation and management. Evaluation and management may vary depending on the patient's age, clinical presentation, potential causes, or practice preference of the provider. Okay, for follow-up of patients with myocarditis, consult the guide for the American Heart Association and the American College of Cardiology. It is important to rule out other potential causes for myocarditis and pericarditis. Consider consultation with infectious disease or rheumatology to assist this evaluation. Okay? Because there could be maybe some autoimmune illnesses that you have to take into consideration. Something other than what you suspect may be going on. So you have to go through a process of ruling out things. Okay? So it says where available, evaluate for potential causes of myocarditis or pericarditis, particularly acute COVID-19 infections such as a PCR testing, current or prior SARS-CoV-2 infections such as detection of SARS-CoV-2 antibodies and other viral cases such as enterovirus, PCR, and comprehensive respiratory viral pathogen testing. After reviewing available data on the risks and benefits, ACIP and the CDC determined that the benefits such as prevention of COVID-19 cases and its severe outcomes outweigh the risk of myocarditis and pericarditis. After receipt of the mRNA COVID-19 vaccines, the CDC continues to recommend COVID-19 vaccinations for everyone 6 months of age and older. If myocarditis or pericarditis is diagnosed after the mRNA COVID vaccination, before giving additional doses, please refer to the last guidance under myocarditis and pericarditis section of the CDC interim clinical considerations for use of COVID-19 vaccines. Okay? For more information, they give you the National Institute of Health on myocarditis and pericarditis, frequently asked questions about VIRS reporting and COVID-19 vaccines. I'll give you a link for that, and how to report to VIRS. Okay? So I will attach all of this for your viewing and your research. So it'll be all available for you to look at. And if you want to dig deeper and you know how to dig deeper, then you'll be able to do it from this. So I'm neutral on it. I just follow the guidance that they give me, and I use my 20, 30 years of knowledge, and I just go from there. And all I can do is give you the information, and suggest that you take care of yourself and you watch out for your loved ones, your family, and do the best thing for you. If you are sick, go to the doctor, go to the emergency room, be treated. Some of the people who have tried to, weather it out and just don't go, they find their home and they're gone. You may need oxygen therapy. You may need to be watched closely as you get over this, but some people don't. So, my wife got it, and I took care of her. So, she got over it, but her sense of taste and her smell has not returned. So, she's having some symptoms, and this is it's like a month out. So, and with this new variant, it is more infectious than all the other ones. And basically what they're saying is that we will probably, end up being infected anyway. Some of us who even take the proper cautions and all that may end up being infected anyway because of the infectious nature of this new variant. So I will provide some more information as I move through. I'll try to spread it out through some of the other shows that I do. I don't want to just bash you over the head with too much of this COVID stuff, but I will be touching on a lot of stuff that's going on in China because I think it's interesting and it can teach you some things, teach us a lot of things, as well as the rest of the world is looking at China pretty closely to see what's coming out of there and how the virus is acting with so many potential reservoirs where it can actually mutate and become stronger. So that can be a major problem. But I'm going to end the show with that. I appreciate you guys listening and supporting the show. And I hope everybody has a good day, night, or evening, morning, whenever you watch the show. And thanks a lot. I'll see you guys later.
I feel like a motherless child, a long way from home. A long way from